Electronic vaccination data system has been live for over 60s for just over a week now. The rollout program, on the other hand, has been riddled with issues from the onset. Well, Health Minister Dr. Zweli Mkhize is confident now that around 5.5 million people will be vaccinated by the end of June. Let's discuss this with Fundile Nyati. He's CEO of Proactive Health Solutions. Fundile, very good morning. Thanks so much for your time. So firstly, new announcements by the Health Minister this morning. Are you encouraged, though, by what you heard from him this morning and what those targets are as well?
Well, yes, I am encouraged. In fact, I've been actually, quite positive that, we will get this thing right as a country. I think there is something that we need to understand, that some things are outside of our control. And by that, I mean the issue of securing vaccine supplies for the country has been the biggest, issue. Because if that was not a problem, we would have been far. Now, countries that are developed countries with more money have made sure that they are the first on the line, and they have used what we call vaccine nationalism to make sure that developing countries like South Africa are last in the queue. So when we are then able to secure 61 million doses, 31 from J&J million, and also 30 from Pfizer, I think that is something good that we should actually applaud. Yes, we have paused the J&J for the past 2 weeks or so, but even that was good because we were interrogating science, and now we can be able to warn our people, of potential dangers of the vaccine without, actually being accused as a country that we ignored something in the US that has caused problems here. What have we not got right? I think we were late into negotiation for these vaccines. We only, firmed up things at the beginning of this year. So that is something that I think we should learn from. But even worse, as a country in 1994, we had the capacity to develop our own vaccines, as a country. And over the years, we've lost that capacity. And so, we should learn then from this that we need to learn to be self-sufficient, because this is not the last, pandemic that we are facing. But I'm happy that, Aspen is at least helping the country now to develop vaccines, although they are using technologies, from elsewhere, but it is something that we should celebrate. Public health education has been a challenge, as far as this is concerned, and it is something that even with vaccination, we need to intensify.
And that's what we're hearing, because we do have, Doc, our reporters out and about in different areas this morning, just gauging, the sort of the run-up to the phase 2, especially with senior citizens. Mostly what we're hearing is that they don't have enough information. A lot of them don't have access to the technology that is required. But we just spoke to Melanie Volmerans just before the break, and she says they've got the programs. Provincially, they need to start getting out there. Are we just a little slow on that, in that process? What's your take on it, in getting the information out there?
Look, from the beginning of the pandemic, this has been, my issue that, yes, there's communication at ministerial level, there's communication at president's level, but below that, especially where service delivery takes place at provincial level and even at municipal level, there really is a big vacuum. And unfortunately, life does not allow for vacuum. And so there's been so many conspiracy theories, in social media and everywhere, filling in, and that has led to a lot of vaccine hesitancy. And it is something then that we cannot allow as we are looking to vaccinate people, because even now there's still a high level of the hesitancy, which is something that we need to address if we're going to meet the level that we are targeting by the end of the year. So yes, I agree. And also people in rural areas who don't have access to the technologies, for EVDS, it's going to be challenging for them. It's much more easier for somebody like me with a smartphone. But what about somebody in my village in Tabasa, in Umtata?
And that's what we're hearing a lot over the past couple of weeks, especially this morning as well. What are our takeaways from this, Doc? I mean, in terms of how we've handled this so far, going forward, what would you say government needs to, or health needs to pick out as to, like you said, where we failed, where we were a bit slow, and where we're doing well in order to meet those targets that we actually need and catch up with the rest of the world as well?
Yeah, I think investing in science and technologies so that we can be much more self-reliant as a country is something that we should take out of this. We've got brilliant, scientists in this country, and our investment just, in genomics has actually put us in the lead to be able to see variants as they are coming in. Many countries are vaccinating without even knowing if they've got variants and whether those variants are actually going to affect the effectiveness of the vaccine. So it is something that we should actually applaud, the country for doing. But the issue of getting to the ground, using some of the lessons from the HIV pandemic on how to mobilize people on the grounds, on the streets, on the wards, to ensure that people, are informed and not just talk about the people using the Queen's language. Not many people are comfortable with. We should learn to educate people using the languages that they are comfortable with, so that when they make decisions, those are informed decisions, and not just assume that, people are just, taking conspiracy theories, because we are sometimes not educating people enough using accessible language. So those are just some of the things. The role of SAPRA as our regulator, working closely with regulators like the FDA. That relationship is very good because it helps to ensure quicker decision making in terms of the licensing of these vaccines. So that is something that we need to strengthen. So there's a lot of things that are going well, and this EVDS system is actually a good system for those who can access technology. So let's invest in those things. Let's not think all is lost. We can still be able, with the public-private partnerships, the pharmacies that are coming, to the party, your discounts and your clinics and other, private, places. Is going to help us to speed up this. So I am not as pessimistic as many South Africans are about the vaccination rollout.
Teamwork on a very large scale there. Thanks very much, Dr. Fundile Nyati. Just looking at where we've gone wrong and what we've got right with this vaccination process. Still on the way here on